Welcome to our first podcast in the series of creating a caregiver toolbox. I'm very excited to be here. I want to thank Frank Nelia from the Contour Mortgage Company for giving us this opportunity to provide this service to everybody in their beautiful Garden City studio. My name is Paula Pagan, and I'm a licensed clinical social worker, and I own a company called Long Island Elder Care. I have worked in the field of social work for over 30 years, and my mission has always been to provide seamless services for my clients and their families. I take a very proactive approach to treatment, and I want my clients to educate themselves about the services that are available to them. We always want to prevent emergency-driven planning, which can lead to a very bad outcome. We provide at Long Island Elder Care mental health counseling to our seniors and their families in our office in Smithtown. We also provide it to seniors in assisted living programs, and we also provide counseling in seniors' home in the community. I am also a CEU provider for social workers and case managers, and we go to various places to provide that services to everybody. So we've all gone through challenging times during the pandemic, and we need to support each other and to help people with coping tools to have to move forward in their lives. We are here to help you, and that's the main reason why we're doing this today. So today I want to introduce somebody that I admire tremendously. Her name is Jennifer Devine, and she's the Director of Business Operations for Caring People Home Care. They provide an array of services that are beneficial for both our caregivers and seniors. So I want to welcome you, Jennifer, to our podcast today.
Thank you so much, Paula.
Right. So can you please tell us a little bit about Caring People and what is a licensed agency versus a companion program?
Sure. Yeah, so Caring People is a full-service licensed home care agency. We have been around since 2001. Prior to that, the founder, Stephen East's grandmother, had a nanny agency. And Stephen would come and he would work for his grandma, and he would get phone calls that would say, I need a nanny for my mom or my dad. So a light bulb went off in his head, and he said, I'd really like to start working with the geriatric community, and he wound up getting Caring People licensed in 2001. So really the difference between a companion agency and a licensed agency is just that as a licensed agency, we are able to provide what's called hands-on care for clients. So we can deal with more medically acute clients, whereas a companion agency is more suitable for able-bodied older adults that just need a little bit of care. A big example I find with the companion agencies is if somebody is losing their keys, their car, that's really hard. So the companions can drive them, take them for errands. They're just not doing the hands-on care needs. I would say that's the biggest difference.
Wow, that's great. Thank you. What insurances do Caring People accept?
So we work with long-term care insurance, and we also work with catastrophic insurance. Otherwise, it would be private pay, and there are agencies, Caring People is not one of them, but there are agencies that are able to accept Medicaid. So if anybody ever were to call us and they had Medicaid, we would get them connected to some of the great agencies that are out there that work with Medicaid.
That's great. Now,
Yeah.
where is your location?
So we are in, we have grown, so I have to remember all of them, but we're in New York, we're in New Jersey, we're in Florida, we're in Connecticut, we're in Massachusetts, and we are now in Texas.
That's wonderful. Where are your offices in New York?
So we have an office in Queens, and that services all the boroughs. We also have an office in the Bronx, which serves Westchester. And then here in Long Island, we're in Jericho, and we also have an office in North Babylon for our Suffolk clients.
That's wonderful. That's a pretty good scope, so that's great.
Yes.
What kind of services do you offer when a family needs services at home?
So we do offer companion services. We offer home health aid services for our clients who need more hands-on care. We can also do nursing services. So we do nursing on an hourly basis, and we can also do it on a visit basis. So an example of that might be somebody who wants to come home on a trach or event, but they need hourly care. So we could provide hourly LPN care for that under the supervision of a nurse. But we could also do supplemental care, such as wound care, maybe injections, IV antibiotics, and that would be considered visits.
Wow. So that's
Yeah.
great to know all your specialties so families will know that they can get those kind of services
Yeah.
from your agency. Do you help families apply for Medicaid for their loved ones? Is that a service you provide?
We do. We have a robust care management team. We were very lucky in 2020 to merge with AMR Care, who has a fantastic reputation in the community doing care management. So that's a service that we offer, as well as Medicaid applications. So one of the things that we're able to do is that if someone is seeing that they're not going to be able to continue to fund their licensed home care, either because they're paying through private pay, sometimes people actually run through their long-term care insurance. We do have a team that will then do the Medicaid application. It is a team of social workers. If those applications seem like they're above what they can handle, we do work with elder care attorneys and we'll refer so that the family gets the right service.
Great, thank you. Can you tell us more about the transition program from home care clients after they have been discharged from the hospital or rehabilitation program?
So what we will do with that is we do currently in Long Island, we now have 2 hospital liaisons, so they really understand that particular type of a discharge. It can be very fast-paced, it can be very complicated. So they are there to really help them to understand the process, and they will hold their hand to get them home. And we do a very detailed intake, so we look specifically at what they're going to need. And sometimes we're going to maybe make a recommendation to be a little bit higher on services. So maybe that first day you're going to do round-the-clock care, and then we're going to step you down gradually. We also have a care transitions coach who's a social worker. She'll follow them for the first 30 days, even if they wind up discharging from services, to really support them to make sure that they don't go back into the hospital. That's the intention.
Which is so important. That's
Yeah.
very, very important. So one thing I'm very excited about when I talk to you is about your animal assistance therapy
Yeah.
program. Could you tell everybody a little bit more about that and how it works?
Sure. So I'm not supposed to have favorites, but it is my favorite program. It's something that's been a dream of mine to be able to do. Because one of the things that we noticed in home care, we have a lot of homebound clients. So they can get isolated. There's not a lot of services that come into the home. But the animal assisted therapy, I would see it in all the communities I was a part of, like the assisted livings, nursing homes. But somehow I couldn't find a program that was willing to go into patients' homes and sit with them at bedside. So during the pandemic, we had a little more time to get some programs off and running. And with one of my colleagues, I have to give her kudos, my colleague Anna, who really took a lot of time interviewing, researching, and doing all that. And she came to me one day and she said, I found this fabulous animal-assisted therapist. Let's talk. And we were able to work it out. And she will individually, she's got 5 dogs.
Wow.
And she tailors, after doing an intake, she matches up the dog according to the intake of that person. So for example, she has one dog that is a 3-legged dog, works with our amputee clients, but she will individually go into the home and she'll work with patients at bedside. And it's really helpful for people who are going through maybe grief, maybe who are going through trauma, such a trauma that they can't really do talk therapy, cognitive issues that might not respond to talk therapy. These are all the wonderful things that we have found since doing animal assisted therapy, that she really connects to those particular populations, among many other. And we do go in, we also will do groups in facilities if that's what a facility calls us and asks us to do. She still does all of that. But I think the uniqueness is that one-on-one.
I think it's a very special type of program.
Yeah.
Is there anything else you would like to elaborate on about caring people and what you do?
Well, I think one of the things that we do really well is we really help people to understand their long-term care insurance plan. I think it's so important to have a verification done on your long-term care insurance plan. What I have found through the years is that a lot of people don't understand their policy. And even if they do, it might be that they're not asking the right questions. And I don't mean that in a criticism, I mean that because you just don't know. But sometimes you can get care management covered. Sometimes you could do modifications in the home.
Exactly, yeah.
There's all these different riders. So I think that's something that we take seriously. We want to educate our clients because we do want them to get the best care. I had a client that I was talking to the other day, and she thought that maybe this private caregiver that she has, she couldn't continue with because her long-term care insurance policy wasn't going to cover her. But that might not be true. So even though I'd love for her to come onto our services and we will be there for her, but if you find a caregiver that's a good match, that's like gold. So I think that's important. That's something important that people really look at their long-term care insurance policies and understand it. And we have
And if they
someone,
don't, to get the help to
Yes.
understand their
Yes.
long-term insurance policies
Yeah.
better, so they can really maximize whatever they need when they need it.
exactly.
So thank you so much. I really appreciate you being here with me today. This is our first podcast, so I'm very excited. And if you have any questions, you could give us a call at Long Island Elder Care, and our phone number is on the podcast today. And I really look forward to more podcasts. We're doing one next week with an elder care attorney. And until we meet again, thank you for being here for us today.
And thank you, Paula. I respect you so much.
Thank you.